Mayam Bukrumzari, Domning Biribasi Impact News ni, I Joyshree Usham na Impact News ki Impact Health Link for a Healthy Manipur program asida taram nokchari. Impact News ki Impact Health Link ki mamange episode ta koina Cancer Awareness Day ga mari lainena World Cancer Day ga mari lainena episode ma pangthokre. Ngasi gi episode asisu koina cancer gi matangda awareness pinabagi pandamda makhatana chathajage ngasi gi topic na new line of treatment immunochemotherapy. Cancer gi lying pathap ki advance over latest trend gi matang da khana na bagi tanja de logjage ngasi gi expert na Dr. Shibashish Bhattacharyya, MD DM Medical Oncology, AOI Babina Specialty Hospital, Khabaisho Imphal dagi. Dr. Shibashish Bhattacharyya is one of the best medical oncologist in Imphal. Chahi kun manga hena experience layer klaba adukum laba doctor ni, and he is currently working as senior medical oncologist at AOI Babina Specialty Hospital. And doctor, thank you so much for taking the time. Thank you for being here with us. Doctor, you are well versed with treating advanced and complex cancer cases. So before we go ahead with the latest trend, we would like to know what is the main reason, or what is the cause of cancer? What are the early signs and symptoms?
It is a very important issue, especially during the observance of World Cancer Day, when we are trying to close the gap of care. 23 and 24, this is the slogan, and this is being observed for last 2 years. And this year also the same theme is there, and to know the cause and to know the early sign and symptom is an important step for the awareness about cancer. Cancer actually happens due to genetic changes within the cells. Cell have got nucleus, and within the nucleus there are chromosomes, and the chromosomes contain number of genes which maintain the cellular integrity. So when these genes are normally functional, normal cells will develop and they will stay for their stipulated lifespan and they will die. So this is the normal cell cycle. When the cell cycle is broken by genetic changes, cancer is one of the outcome. There are many outcomes. It can be degenerative, it can be others. But cancer is basically a genetic disorder. Don't confuse genetic with hereditary. Genetic means cause is in the gene, and hereditary is when the cause lies in the germ cells, mainly the cells which are there in the sex chromosome and which are there in the going from one generation to other generation. So the germ cell must be containing that genetic changes, like very famous BRCA gene, for which Mrs. Angelina Jolie went for prophylactic surgery of the breasts and ovary. She did not have cancer. Her mother had cancer. She knew that mother carrying that gene, and she tested herself, came forward, and she came forward also that she has undergone this surgery. So that is very important. So preventive surgery for the hereditary cancer. But all cancers are not hereditary. Majority are not hereditary. They are basically sporadic genetic changes in the cancer cells, in the cells causing cancer.
Okay, so doctor, if all the cancer is not hereditary, then what are the chances that a normal person will go through genetic changes?
Normal person goes through genetic changes due to environmental insult. There are environmental pollution and there are environmental other factor, non-polluting factor, like bacterial infection, viral infection, very important, like HIV virus, human papilloma virus. So these are oncogenic virus. These viruses enter into the cell and assemble part of their genome into normal human chromosome, and by that and addition of extra oncogenic driver chromosome part gene, and then it will push the cell towards the pathway of carcinogenesis. And that is why the now government of India has also came out with the program to vaccinate post-pubertal children, 9 to 14 years of females, with vaccination with anti-human papilloma virus, which is now produced in India, and that is a great step towards prevention of the second most common cancer in the female, that is cervical cancer.
Okay, doctor, some schools they have made circulation even for this vaccine that even boys can get vaccinated. Is it true?
Yes, boys also should be vaccinated because this is a sexually transmitted virus which is not symptomatic, but it produces permanent changes. So in case of females, it is the route of transmission is normally vaginal intercourse, but in addition there are oral cavity and the rectal anal canal, which can be other source of infection. So in that cases the boys can be prevented from penile cancer, anal cancer and oral cancer by giving this vaccination, especially head neck squamous cancer, oral cavity and anal cancer and the penis cancer are all caused by the same human papilloma virus, and by this vaccine if taken they can be prevented, but so it should be given before starting of the sex life of that child.
Okay, so it is recommended for both boys and girls.
Both boys and girls, but it is more common in female. That's why government from the taxpayers money is now authorized it for the females of that particular age group. But if a female has crossed that age after declaration of the program, she can also take it from her own resources.
Okay, doctor, you have mentioned about non-pollutant factors for
like virus.
Yes, what are the pollutants?
Pollutants are there are shoots, very important pollutant when you use the barbecue and other. Okay. So those are smoked food. So it has been seen in Japan that stomach cancer commonest cause is the smoked food. They consume it too much. So
what about fermented
fish? Food like this, smoked and fermented together, which is very much in practice in this part of the country. So that is also an important cause, and we have found out that stomach cancer, esophagus cancer in Manipur and Mizoram is quite common due to this food habit, and that lifestyle changes might change the course of the epidemiology.
Among the food habit, this tobacco products also.
Tobacco product is most important carcinogen, and tobacco in any form, be it smoking, be it chewing, whatever, it can produce the problem.
Okay, doctor, you have mentioned that most of the cancer are not hereditary, but they are environmental induced. So could you please name some of the environmentally induced cancers?
These are all environmental induced cancer, like smoking related lung cancer and other pollutant related cancers, and smoking causes cancer from upper part of the body to lower part of the body everywhere, including pancreas cancer, including renal cell cancer, including prostate cancer. They have found association of tobacco induced changes in the cells, because tobacco after formation eliminates so many radioisotopes, polonium, and that is most important cause of carcinogenesis. So one should try to avoid smoking, and best possible way, if he doesn't take up this habit, or if he is already smoking, should try to quit immediately.
But this food habit, for example, eating smoked meat or fermented fishes, these have been these are traditional foods, so to say, for the people of Northeast. So don't you think like people will be like their body would have been accustomed to taking this food, or are they still at risk of taking
yes, they are at risk. That has been proven beyond doubt, this food habit and its association with cancer. That has been proven beyond doubt. But that doesn't mean that everybody will have it. There is a
very high risk.
Very high risk.
Doctor, what about blood cancer or leukemia?
Blood cancer is totally genetic changes in the blood cells, blood producing stem cells.
Hereditary.
Not hereditary, genetic.
Genetic.
So don't confuse between genetic and hereditary. Genetic is all cancer is genetic in nature. Okay. It is a genetic change that produces the cancer.
And doctor, coming to the early signs and symptoms, what we must.
They are very common early signs which you may neglect initially, like chronic cough and weight loss, loss of appetite, fever, sometimes yellowish discoloration of the sclera and eyes and oral cavity. So that is called jaundice. Like that, in blood cancer, patient may produce anemia, patient may have recurrent fever, may start bleeding from the sides. So these are the signs which you can pick up. This is nothing great of cancer, it can happen many causes. So one should be going to the doctor immediately once he or she develops some problem, and doctor's duty is to find out at the earliest that he is not suffering from. So in medical curriculum there are strict protocol following that. The doctors normally treat the patient, and based on that guideline, at some stage within 1 month or 2 months, if the problem is not solved, it is coming out to be a cancer in many cases.
So doctor, what are the latest trends in treating cancer, including immunochemotherapy?
It's a very important question. It is relatively new form of treatment. In cancer care, surgery, I always tell, it is a 1,000 years of old treatment. This is called surgical strike or precise strike. By surgery, you can remove the tumor from the body. So that has been there from time immemorial. When human being had some form of medical treatment, surgery was there. But surgery was followed by next development is in the radiation oncology. So uses of rays that is coming out from the radioisotope initially, now it is created by a machine called linear accelerator. So no more radioisotopes are needed. Earlier radioisotopes were, source was placed within the radiotherapy machine and radiation was given, and people got Nobel Prize on that discovery. So radiation oncology, it has started its journey in 1910, so it has already crossed 110 years. Then came the chemotherapy or systemic treatment, the drugs. So that journey has started only in 1940 during World War. That time it came into being accidentally. Nitrogen mustard was found to be effective in killing cancer cells, and similarly in the laboratory, Dr. Yella Pragata Subbarao, he discovered that folic acid synthesis pathway, one medication called methotrexate today, that time no name was not there, and that was used by Dr. Farber. He was a pediatrician, pathologist who used to do autopsy, not treating pediatrician, clinician. But he saw that children are dying, and he got an opportunity to treat patients under the staircase, almost neglected dying children. On them he used those drugs, methotrexate, and that was a marvelous. So methotrexate is still used. But the problem of this chemotherapy, there are so many drugs discovered further till 2000. So those drugs were a great discovery, but those drugs were not working on a target. They are working on all the dividing cells. So in addition to killing cancer cells, they are also killing healthy dividing cells like oral cavity, like bone marrow, like hair follicle. So these three are the cells which is also killed by the anti-cancer drugs. That's why people become bald, people become anemic, people become low platelet count and low WBC count, causing infection. So these are the common side effects. So due to those side effects, people used to avoid chemotherapy, were scared of giving chemotherapy. If you give a choice, they will always tell, can't we avoid chemotherapy, because he must have some experience. So there was a stigma, because chemotherapy is like a carpet bombing. When you bomb on a city, you will not be able to identify which house the actual enemy is there. There will be collateral damages. So chemotherapy produces lot of collateral damages in the other system. And these targeted therapies on finding a target on the cell cycle, cell wall, or in the inside the cell, if a target is detected and if you use the drug on that target, so other cells will not be affected. So there will be less of collateral damages, and that is why how immunotherapy came, because it all started in the blood cancer. Targeted therapy also started in blood cancer called chronic myeloid leukemia, where a particular drug imatinib was discovered, in 2000, and it totally changed the scenario.
2000 it started. So it's the latest trend.
That is the only 2000 it started. That is the single gene was targeted by a tablet, and that tablet produced 5 to 10 years. Earlier, chronic myeloid leukemia means you have to go for stem cell transplantation, bone marrow transplantation. But nowadays, very hardly we offer the chronic myeloid leukemia patient to bone marrow transplantation. So we can treat the acute chronic myeloid leukemia by this drug, and there are subsequent second and third generation targets therapies which can take care in the resistant cases also. So this is a small molecule target, and immunotherapy is using a monoclonal antibody. Nowadays we call it monoclonal because we are using genetic recombination technology, DNA recombinant technology, but earlier we were using on the horse serum. It was used against rabies, it was against tetanus, diphtheria. So these all immunotherapy was there, but that time the problem was allergy, allergic reaction to the horse serum, because that is extracted from horse or pork. Even insulin was also discovered when initially from the pork pancreas that was smashed and made the insulin. But now no more those days are there. Now these are all courtesy of the scientific discovery of DNA recombinant technology, which has produced the revolution.
So
it is a biotechnology subject now. So in the laboratory we can produce designed drugs, immunotherapy to particular target, and find it out whether it is there in the patient or not, and use that target for our precise target.
So basically the immunochemotherapy, it targets only the defected or the harmful cells, and then it overcomes all the disadvantages
of chemotherapy.
Okay, doctor will know more about immunochemotherapy, but let's take a small break here. Doctor na hozik faubada cancer lying pathapki magi tongan ba surgery tauba radiology radio arrays is na lying ba de chemotherapy sinda ba du hozik latest trend immunochemotherapy ki matang da takpiri adu matang aswai da ten ba commercial break lojage break ki matung da hariba anauba therapy asigi matang da khangbina kishi.
Medyo habna miyamda ahanba oina Samsung smartphone da interest amata yaudana loan da lauba yabagi kudung chaba pijari. Masida natana Realme, MI, OnePlus, Vivo na chingba smartphone singda ahongba mamalda fanghanjari. Akupa marol gidamak lingsin biraksi medyo hab kay sampat konjeng hajari laikai.
Break matungda muka hana taram nokchari ngasi akhoina impact health link da khana jarmi ba topic asi cancer laina ge khwaidagi anauba latest trend of therapy mingwena palabada immunochemotherapy gi matang dani aduga akhoi ge expert guest na Dr. Shibashish Bhattacharyya MD DM Medical Oncology AOI Babina Specialty Hospital dagi. Doctor, coming back to this new treatment method for cancer, Doctor, you have mentioned that about the advantages as well as the disadvantages of other method. So is this new therapy applicable for all types of cancer, or is it only for blood cancer?
This is a very important topic. Now, not only blood cancer, all drug discovery has started in blood cancer. Blood cancer are not very common cancer. It is relatively rare cancer. But more researchers have gone into blood cancer research. That is why majority of the blood cancers are very easily treatable and almost curable in majority of the cases. So blood cancer treatment is the great success story of cancer care, especially in the field of medical oncology, where we are using systemic treatment to treat cancer. So like I was mentioning, the simple tablet was sufficient to kill chronic myeloid leukemia and cure them totally. So that's how the targeted therapy started of journey with the imatinib. That was a a great discovery, and subsequently came the rituximab, which is a antibody against the CD20 receptor. So that receptor is present on the cancer cell. So this antibody will go and bind with that cell, and the chemotherapy also will be directed to that, and they will all kill together the cancer cells only. They will not hamper death of other cells. So that is how the immunotherapy works. Now we have another form of immunotherapy where we are giving a monoclonal antibody called pembrolizumab or durvalumab, which is against the programmed death ligand or programmed death receptor. These two are on the tumor cell and the T cells. So body's T cell is there, it is a immune mechanism to evade by the cancer cells. Cancer cells do not get destroyed by the T cells because they have a mechanism of immune evasion. It is a hallmark of cancer. So what happens when a cancer cell is there, it has a receptor called PD1 and here is a ligand called PDL1. So once these two gets touched, immediately the cancer cell will not be attacked by the T cell. T cell will not be activated and mount the immunity and cytotoxic material towards that cell. So when we use this molecule, it will stop the cancer molecular immunological evasion. So it will block the PD1 or PDL1 receptor.
So for any type of cancer?
For any type of cancer. So this is a all pervasive form of treatment, and majority of the cases different types of cancer are not at all linked because it's body's own immune system which is being activated.
Okay, but I'm curious to know, doctor, this therapy, at what stage of cancer can this therapy be very successful? Because like for example, in the advanced cases, will surgery be the only option, or will this therapy has to be started in the initial stage?
No, surgery is the treatment of choice in the most of the cases in the early cancer. Surgery and radiotherapy are a localized therapy. I initially told that when tumor is localized to a organ, you can remove that organ or you can remove the only tumor. But when tumor has gone beyond that, disseminated, it has gone into lungs, liver, so what we will cut?
Surgery is not helpful in that.
What we will cut? That is not a single organ. So you cannot remove entire body. Everywhere cancer is there.
So
in that case, this earlier chemotherapy was alone. Now the armamentarium is sufficient enough with the immunotherapy so that we can kill different types of cancer cells, starting from gallbladder, lung cancer, rectal cancer, colon cancer, breast cancer. Everywhere this immunotherapy is coming in a big way, and every day new researches are coming, new indications are coming. So that is a great success.
Very hopeful for cancer patients.
Yes, yes.
Doctor, now this therapy, immunotherapy is available at Babina, AOI Babina. So is the same therapy available here as those available in developed countries like UK?
Yes, yes. Actually, the immunotherapy medications are still in the zone of proprietary patent, and India is a country where the patented drugs cannot be made by the generic drug producing company. So in monoclonal antibody they call it biosimilar. So many of the costly immunotherapies which were difficult to be prescribed in 2010 or 9 are now available in the biosimilar form, and they are part of the therapy within the card. The government provides CMHT and PMJY card. So there the generic medicines are covered and the biosimilar monoclonal antibodies are covered, and these are all proprietary. So these are very costly. So we have to depend on the patient support program for this, because they give some option like you take 5 doses and lifelong it will be provided to you free. So such patient support program is also there, and we help the patient by those patient support program in addition to CMHT and PMJY card.
So this particular therapy is not covered as of now?
No, they are partially covered. Some medicines are covered which have got biosimilar product available. Cost is within 25 to 30,000. But which are patented medications where the biosimilar has not yet been permitted by the Drug Regulatory Authority to be produced in India. So that is a drug development and drug regulation procedure. So if it is a patented drug, if it is a patented drug, you cannot allow the Indian pharmaceuticals to. But Indian pharmaceuticals have great research and development wing, and once any drug gets off patent, immediately within months we get the biosimilar version of the monoclonal antibodies, and automatically cost comes down. There is a good competition. So now it is available in the most of the older immunotherapies of 2000. Now they are available almost throwaway prices within the cart system, and we hope that in near future, when these will be off patented, this pembrolizumab, durvalumab, which are still under patent rule, will also be available to the common masses.
Thank you, doctor, and sorry for that. Got something in my throat. So, doctor, at AOI Babina, when a patient is detected with cancer, how do you go about treating the patient? Like, what is tumor board?
Actually, very important question that makes a difference. Like a tumor board is the thing which takes care of the patient and takes care of the care provider as well. Because if you start treating in a particular direction individually, you may go wrong. It is not wrong. There are difference of opinion. There are discretionary opinions. But once you discuss the case in detail with all the stakeholders, in the tumor board, thrice a week, we have the institutional tumor board in AOI Babina Hospital, where we all meet with the surgeon, medical oncologist, surgical oncologist, radiation oncologist, nuclear medicine consultant, our oncopathologist, and radio diagnosis person.
Even this
immunotherapy is a therapy which is offered by the medical oncologist, but we all discuss, and we get input from all the stakeholders, which
will be the best
possible treatment for that individual patient. So we give precision therapy, cancer care. That is our aim of AOI, to give a precision of care on cancer.
Because most majority of the cancer deaths are reported from low income and middle income families. So that's why I believe the hospital will also, consider into that and provide the best and affordable.
Yes, ours is a most cost effective treatment strategy we are utilizing, and with the blessing of the patients and their caregivers, I think more and more patients will be covered. But it needs awareness that the name of the institute, American Oncology, doesn't mean that it will be costly. We are most cost effective treatment strategist at the present moment.
Okay. And now the best would be if we don't get cancer at all. So as we conclude the program, I would like you to give us some suggestions or ways to prevent cancer and message for the public.
So first of all, cancer screening and cancer prevention, primary prevention, that is the vaccination and cessation and not acquiring the tobacco habit, excess of alcohol, other viral infection like hepatitis B, C, HIV, and if you can avoid all these, the major part of the cancer susceptibility will be eliminated. And even if you develop early cancer, if by screening, if you are detected with a small breast lump, your chance of getting cure is 99% compared to a advanced breast cancer where chance of survival will be much less. So it is always better primary prevention, then it is secondary prevention, means early detection and screening. Primary prevention is cancer, viral vaccine is there, and tertiary prevention is once you have got advanced cancer also, we treat you rigorously so that we can give good quality of life with meaningful years. We can add meaningful years to your life. We may not prolong your life too much, but give you sufferings. So our aim in advanced cancer is giving a meaningful quality of life in quantity and quality as well.
For the remaining years of
the remaining years.
Thank you so much, doctor. In this short episode, we have covered so much about cancer. You have raised awareness and about cancer itself and the latest trend. Thank you so much once again.
Kuranjai.
Ngasigi episode asida akoina cancer gi matangda magi latest treatment therapy gi matangda Dr. Shibashish Bhattacharyya MD DM Medical Oncology AY Babina Specialty Hospital degi khaminakre mathangi episode ta atopa topic ma pudun lakchage haraga miyam degi kanina pa yathang ni jari. Thank you.
Jaba, Taibang Malim Laikolda, Aikwai Kwai gi irakta tilamba.